Good afternoon, everyone. My name is Katie Potestio, and I am with the Chronic Disease Prevention Team here at the Association of State and Territorial Health Officials. I would like to welcome you to today's interactive webinar, How State Health Agencies Can Support Effective Early Care and Education Initiatives to Meet the Physical Activity Guidelines for Americans. ASTHO, with support from the Office of Disease Prevention and Health Promotion, is working on this exciting project to assess the current uses of the Physical Activity Guidelines for Americans and to educate and mobilize state health leadership to utilize and integrate the guidelines throughout agency programming. ASTHO is working to capture state stories, develop an issue brief, and other resources to support the implementation of the guidelines, which will be available on ASTHO's website. In addition, today's webinar is the second in a series of 4 webinars in the Physical Activity Guidelines for Americans webinar series and will be posted to our website in the next couple of days. The objectives for today's webinar are to provide an overview of the Physical Activity Guidelines for Americans Midcourse Report, to describe the evidence-based recommendations from the Midcourse Report for Early Care and Education, and to provide examples of how state health agencies can lead or support effective strategies to increase physical activity in early care and education. We have an esteemed panel of experts that will be speaking with you today. Following my introductions, all of the speakers will present their slides. If you have a question, you are welcome to post it to the chat box on your screen at any time during the webinar. These questions will be used during the Q&A at the end of today's presentations. You will also have the opportunity to type any additional questions into the chat box during the Q&A session. At the end of today's webinar, you will be directed to an evaluation survey. Please take a few moments to inform us about the work you are doing to increase physical activity in your state and provide us with feedback on today's webinar. We look forward to hearing about your efforts. Our first speaker today is Dr. Russell Pate. Dr. Pate serves as a professor in the Department of Exercise Science at the University of South Carolina. Dr. Pate is an exercise physiologist with interests in physical fitness in children and the health implications of physical activity. He has published more than 275 scholarly papers and has authored or edited 7 books. He served on the subcommittee for the Physical Activities Guidelines for Americans Midcourse Report and currently chairs the coordinating committee for the National Physical Activity Plan. I will now turn it over to Dr. Pate.
Well, thank you very much. It's an honor to be invited to participate today, and I'm particularly excited to have been asked to speak about the recommendations that have been included in the Physical Activity Guidelines for Americans Midcourse Report for the preschool and child care setting. It's one that I personally care a lot about, have worked in for quite a long while, and I think the report has made a particularly important contribution to promotion of physical activity in this particular setting. So I'm honored to be asked to speak with you today. Just by way of brief background, of course, the first federally approved physical activity guidelines for Americans were released in 2008 by the U.S. Department of Health and Human Services, and the occasion of the 5th anniversary of the release of those guidelines has been taken for the purpose of producing this midcourse report that, in a sense, I think extends the scope of the guidelines. The guidelines themselves, of course, include a very comprehensive set of recommendations on the types and amounts of physical activity that are appropriate for the provision of health benefits, and but the guidelines per se do not necessarily go into much detail with regard to the nature of the steps that can and should be taken to enhance the probability that Americans will meet those guidelines. And so I think the decision to focus this midcourse report on approaches to promoting increasing physical activity in youth was a particularly important step. And I'll mention that the inclusion of this particular age group, the preschool and early childhood age group, is an important step forward. The guidelines per se did not include children younger than age 6. And so I think it was an important decision to include this young age group in this mid-course report. The report is organized around 5 settings, and they're indicated on this slide. As mentioned, I'll be focusing today on the preschool and childcare setting, but I think subsequent webinars will focus on other settings, including the school setting, which is probably the setting in which the scientific evidence is the best established and most advanced. In addition, the report includes recommendations for the primary care, healthcare setting, family and home setting, which we all recognize as a critical one for youth, as well as the community settings. So today, my job is to overview the recommendations included in the report for the preschool and childcare setting. And I'll say that the recommendations are based on a very extensive review of the available evidence. And so, I think there are probably for each of the settings cases in which individual or subgroups of the membership of the panel that developed the report may personally feel that we could have gone a little further with the recommendations, but we tried to stay true to the published evidence available to support the recommendations, and that's certainly what we did in the preschool and child care setting, and consequently, I think we can have considerable confidence that there is solid evidence to support these recommendations. So for the preschool and child care setting, the key background elements are that millions of children, this estimate 4.2 million, but certainly millions of children across the U.S. are enrolled in center-based preschools in the U.S. And of course, over the last several decades, there's been a tremendous increase in structured preschool and child care settings. Many more children today than a few decades ago are spending a great deal of their typical school day in these settings, and consequently, it seems self-evident that the nature of the exposures in those settings can have a major influence on their physical activity and undoubtedly other health parameters as well. And there is a growing literature that has established that the characteristics of the child care environment can and do impact children's levels of physical activity while they're in that setting, and so it did seem appropriate to address this setting in this report. And so to summarize the key findings that are indicated in the report, the following steps are seen as appropriate evidence-based approaches to promoting kids' physical activity while they're in the child care setting. First is provide portable play equipment on playgrounds and in other play spaces. We know from the research that kids are more likely to be active when they're given access to play equipment that they can move. And I guess the other side of the coin would be the more traditional play equipment like jungle gyms and so on that are static, and several studies have observed that kids are much more likely to be active in a play space when they have portable play equipment that they can move around. So that would be balls and hoops and tricycles and mobile equipment of that sort. With the more static play structures, the tendency is for kids to connect to those, but not necessarily move a great deal while they're in contact with them. So one recommendation is include portable play equipment in play spaces. A second finding is that providing staff with training in delivery of structured physical activity sessions for children is appropriate, necessary really, and increasing the time allocated for such sessions is also very important. So These would be planned activity sessions with adult leadership. Having worked a good bit in this setting, I strongly endorse this particular finding and recommendation in the report. I think it's clear that the professional staff that work in these settings can be prepared to provide effective physical activity sessions for kids, but they're not necessarily trained to do so through their traditional training programs. And so provision of such training is probably important for an effective implementation of this strategy. And of course, the ancillary to that is that it's important that time be allocated for such sessions, and because in many child care settings, this is not currently part of the established schedule for the program. A third recommendation is that that we integrate physically active teaching and learning activities into the pre-academic instructional program of the school. It has been well demonstrated in previous work in child care settings that kids can learn very effectively while they're moving, though that approach is not necessarily well established or intuitive in the typical child care setting. And so the recommendation here is that we systematically incorporate into the day, into the planned instructional program, teaching learning activities that in which the kids are physically active. And then the fourth key finding is that increasing time that children spend outside is an efficacious approach to increasing their activity. The literature in this area is really quite consistent. It's been shown a number of times that kids of this age and other ages for that matter are much more likely to be physically active if they're outside as opposed to inside. And so a key recommendation is that child care centers and preschools plan for that time and protect it. And I guess an ancillary to this would be that in the case of inclement weather, that provision be made for the kids to be active in an appropriate indoor space, but that whenever possible, the kids be given plenty of time outside, because there's a very high probability that they will be more physically active when they're in that outside setting than when they're inside. So those are the key findings of the report, and several important strategies there for promoting physical activity in kids. There's a reason why children younger than age 6 were not included in the 2008 physical activity guidelines for Americans, and it's because the evidence linking physical activity to health outcomes in that age group was not well established at that time. But in the interim, there really has been a tremendous amount of work undertaken, and so I think it's my reading, at least, that we know a lot more now about physical activity in kids of this age than we did 5 years ago, and I think we're going to know a lot more still in just a few years down the road. And so, our committee did make several research recommendations, areas in which we need more work on physical activity and its promotion in kids of this age. Just quickly, I'll mention that the group recommended that we conduct more longitudinal observational studies with the strongest possible measures. We need to understand as much as we can about the natural history of physical activity in kids this age, and of course the factors that influence that physical activity, as well as the health outcomes that may be associated with it. Another recommendation is that we examine specific strategies to promote physical activity in the child care setting. In very recent years, there have been kind of rapid growth in this area of the research, and much more work is needed to strengthen the evidence that would guide us in intervening to increase activity in this setting. It's also recommended that we conduct policy research to examine the effects of state and institutional policy innovations. Many on the webinar today, I think, will be aware that preschools in the child care setting is a very active policy arena right now. A lot of states are revisiting their guidelines or looking to establish guidelines for physical activity, and often paired with dietary guidelines as well. My home state of South Carolina has just recently released new standards for physical activity and diet in the child care setting, and I know many states are revisiting this or visiting it for the first time as a policy issue. So clearly we need well-done policy research to advance our understanding of how best to move forward in this area. We need research examining the effect of the center physical environment on child physical activity. That would be sort of independent of the programming of the center, but I think we do know that the physical environment is an important factor influencing activity, and we need to refine our knowledge of the physical characteristics of child care centers that may have important effects on the activity level of the kids attending those centers. We need to investigate center-based interventions that involve parents and activities at the home. I think at this point we don't know a great deal about how to effectively link from the child care center to the parents and the home environment, but clearly both are very important in influencing the child's physical activity. And finally, it's recommended that we compare intervention effects across race, ethnicity, and socioeconomic groups. Clearly there's enormous diversity in the kinds of child care centers that are available to kids across our communities, and understanding how those diversity-related factors influence outcomes of interest here be very important for moving forward in this area. This is an infographic that was prepared in association with the report, and of course you see the preschool setting up there in the upper right, along with the other settings that are addressed in the report. And with that, I'll thank you for your attention, and I'll look forward to the ensuing discussion. Thank you for your attention.
Thank you, Dr. Pate. As you can see on your screen, we have a polling question up. Which interventions have suggestive evidence that they can increase physical activity among young children during the school day? Please go ahead and submit your answers now while I introduce our next speakers. The next speakers are Dr. Craig Andrade and Christina Nordstrom from the Massachusetts Department of Public Health. Dr. Andrade is the Director of the Office of Community Health, where he oversees the planning, development, and implementation strategies that support and reinforce healthful behaviors by its programs. Some of these programs include nutrition, physical activity and obesity prevention, and mass in motion community initiatives. Ms. Nordstrom is the Director of the Nutrition, Physical Activity, and Obesity Prevention Program. This CDC-funded initiative works to implement policy, systems, and environmental change strategies to promote healthy eating and active living for the Mass in Motion initiative. The poll is now closed. As you can see, everyone selected the correct answer, all of the above. As Dr. Pate just discussed, all of these interventions have suggestive evidence that they can increase physical activity among young children. I will now turn it over to the Massachusetts team.
Thank you for the opportunity to share the Massachusetts experience in developing and implementing the Mass Children at Play initiative. Before discussing Mass Children at Play, it's important to mention that Mass Children at Play is part of a larger state effort called Mass in Motion. Mass in Motion is a comprehensive initiative aimed at promoting healthy behaviors and preventing and reducing chronic disease and the risk factors, including obesity. Starting with some history, Mass Children at Play was originally funded as a pilot program through the American Investment and Recovery Act of 2009 through the CDC's Communities Putting Prevention to Work grant initiative. The goal was to build the capacity of child care programs to assess and improve the nutrition and physical activity policies, systems, and environments currently in place and center-based child care programs, as well as in family-based child care homes throughout Massachusetts. The initiative helped child care providers implement a new regulation which required licensed center-based child care providers to offer opportunities for child care and full-day care to participate in at least 60 minutes of daily physical activity. This regulation was issued by the Massachusetts Department of Early Education and Care and became effective in January 2010. So why do we need a program like Mass Children at Play? According to the 2009 data used at the time to develop the initiative, WIC, the Women's Infant and Children's Program, reported that 14.7% of low-income preschool children ages 2 to 4 in Massachusetts were obese. The Massachusetts Youth Health Survey reported that 10% of middle school students, grades 6 through 8, were obese. The Mass Youth Risk Behavior Survey noted that 11% of high school students, grades 9 through 12, were obese, and 67% of middle school and 66% of high school students are not meeting the recommended 60 minutes of physical activity 5 days a week. In response, Mass Children at Play aims to establish and sustain supportive environments in child care settings to give children throughout the Commonwealth an early, healthy start.
And by way of some more background, before 2010, only family daycare providers were required to provide 30 minutes of daily physical activity for children in their care. To help address the child-to-obesity problem in Massachusetts, the Department of Early Education and Care proposed, and the state passed, the regulation requiring licensed child-based child care providers, as well as family daycare providers, to offer opportunities for children to have at least 60 minutes of daily physical activity beginning in January 2010 to meet the new PA guidelines. The larger regulatory effort included revised standards on child toothbrushing and ECE provider training. It applied to family child care, center-based child care, and after-school programs as well. We found that stakeholder engagement and training were critical to the success of implementing the regulation. It was important to take the time to discuss the potential impact of the regulations on individual programs. The physical activity regulation affected more than 2,000 licensed child care centers in the state. EEC and the Department of Public Health spent considerable time identifying and developing resources to explain the rationale behind the new regulations and to support licensees in meeting them. These resources included sample forms and templates, technical assistance papers and guidelines, online training, and links to other useful resources. And so to help child care facilities and family daycare providers meet these new requirements, the Massachusetts Department of Public Health partnered with the Department of Early Education and Care and other key stakeholders to create Mass Children at Play. One of the roles of state leadership in developing this program is to leverage existing relationships between and among agencies and key stakeholders. Leadership at the Department of Public Health had an established relationship with the Commissioner of Early Education and Care, which facilitated a formal interagency service agreement and provided staff to help in program development after the pilot phase. The department also works in partnership with researchers at Harvard School of Public Health and with the Commissioner and leadership within the Department of Elementary and Secondary Education. And the relationship with the Head Start program allowed MCAP to incorporate Head Start's I Am Moving, I Am Learning program into the MCAP Toolkit and certification program. Leadership's role was also to promote and ensure a statewide scope for the project. So in collaboration with EEC, the Department of Public Health convened a statewide interagency advisory group. Key to this partnership was the Massachusetts Association of the Education for Young Children, which is an affiliate of the National Association of the Education for Young Children, the nation's largest and most influential organization of early childhood educators. Other partners included Head Start, the Department of Elementary and Secondary Education, and Harvard School of Public Health. And so the role of this advisory group was to participate in planning and providing training, technical assistance, and support groups dedicated to improving the quality of programs for children. The goals of Mass Children at Play are to help child care staff evaluate policies and practices and create an implementation plan, provide 60 minutes of daily physical activity, offer healthy foods and snacks, promote age-appropriate active play and healthy eating, and provide information for parents, too. Mass Children at Play use 2 evidence-based programs to assess and establish policies and implement systems and environmental supports for child care programs to provide healthy foods and beverages and increased opportunities for physical activity. These were recommended in the White House Task Force on Childhood Obesity. Using a train-the-trainer model, the training initially targeted child care health consultants, which we called mentors, to work with local child care providers. And then an MCAP Toolkit was developed as a result of a comprehensive program evaluation. The 2 evidence-based programs are the Nutrition and Physical Activity Self-Assessment for Child Care Centers, or NAPSAC, which was developed by the University of North Carolina. The I Am Moving, I Am Learning program was developed by Head Start. Mentors were trained to help child care centers complete the nutrition and physical activity self-assessment and then create and implement an action plan. PLCs, or professional learning communities, are being established this year to provide child care mentors and providers with the opportunities to network, share best practices, and participate in quality improvement projects. After the training, child care providers were paired with experienced mentors to develop an action plan aimed at improving institutional practices and environments to increase opportunities for physical activity and healthy eating. Mentors customized the activities to best fit the needs and goals of each child care provider. Again, guidance on program development and implementation was provided by the Interagency Advisory Group of experts from multiple disciplines. Between October 2010 and January 2012, 44 mentors were trained and worked with 264 individual child care centers and family child care settings. In terms of potential state reach, there are about 10,650 sites and 156,500 children in family and center-based child care in any given year in the Commonwealth.
The intended impact of Mass Children at Play is to increase supportive environments and policies among daycare providers that increase physical activity among children in daycare settings, to increase knowledge and skill of child care providers that will support implementation of the physical activity regulation, and to increase the amount of time young children spend each day being physically active, preparing them for a lifetime of activity and reducing the risk of obesity and being overweight. To address sustainability of the program, the Mass Department of Public Health CDC-funded Nutrition, Physical Activity, and Obesity Prevention Program collaborates with the Department's Early Childhood Comprehensive System Project, Race to the Top Early Learning Challenge. Using the Mass Children at Play Toolkit developed by the Department, this work incorporates the elements of the Mass Children at Play initiative into statewide provider training programs and can lead to certification as a Mass Children at Play mentor or child care provider. Again, professional learning communities are being established this year. The Mass Children at Play initiative has been adopted by the Massachusetts Childhood Obesity Demonstration Project, also called Mass in Motion Kids. Training scheduled for the spring of 2013 targeted to child care center providers in the cities of Fitchburg and New Bedford will be open to all child care providers in the Commonwealth. In terms of lessons learned, a substantial investment of time is required to lay the groundwork and secure stakeholder buy-in for regulatory change. This process was critical to facilitate the acceptance of the proposed regulation. It's also important to demystify the concept of policy among child care providers by referring to policy as a practice, a rule, or as an agreed upon way of doing things in the center. In conclusion, those looking for information about Mass Children at Play or related work are welcome to contact me or refer to the noted web links.
Thank you so much for sharing your efforts in Massachusetts. As you can see on your screen, we have another polling question. Which of the Midcourse Report's recommendations to increase physical activity in early care and education are you most likely to implement? Please go ahead and submit your answers now while I introduce our last speaker. Our final speaker is Kelly Stater. Ms. Stater is the Nutrition Coordinator for the Chronic Disease Prevention Program at the Wisconsin Department of Health Services. She is also an active member of the Wisconsin Early Childhood Obesity Prevention Initiative, which aims to improve nutrition and physical activity among young children and their families. The poll is now closed. It looks like our audience today is most likely to increase physical activity among youth by providing staff training, followed by integrating physical activity into daily routines. And now I will turn it over to Kelly.
Thank you, Katie, and thank you to ASTHO for inviting us to present on a lot of the work we're doing here in Wisconsin in the early childhood setting. Today I'm going to present on our Active Early project, which is for physical activity in the early childhood setting. But before I get into details about that, I'll provide some background information. So this kind of reiterates what was already talked about today of how important the child care setting is. We know that child care settings, along with things like schools and work sites, really offer prime environments where we have a lot of control over physical activity and nutrition behaviors. And in Wisconsin, that translates to a reach of over 230,000 children. We know that children who are in the early care and education setting on average spend over 30 hours a week in that care, so we have a lot of opportunity to intervene in that setting. Hopefully most of you on the call are very familiar with the social ecological model, which is what our program and department uses. We try to affect change at the behavior, environment, and policy level so that we can have as much impact as possible and also have sustainable change. So this slide gives you an overview of what we call here in Wisconsin the Wisconsin Early Childhood Obesity Prevention Initiative, or what we affectionately call WECOPI. And WECOPI's mission is to develop and implement a collaborative, statewide, multi-strategy, evidence-based initiative that really focuses on children ages 5 and under and their families, and aims to prevent childhood obesity by improving the nutrition and physical activity behavior and environments that those children live in. So you can see here on the slide some of the key members of WECOPI, including the Department of Health Services, which is where I sit, as well as the Department of Public Instruction, which is our education department, the Department of Children and Families, which houses the licensing and regulation for child care providers in our state, the University of Wisconsin Extension, which provides a lot of education to those providers, as well as a few non-governmental organizations like the Wisconsin Early Childhood Association and Supporting Families Together Association, which both serve as kind of conduits to providers in our state and provide a lot of the training and technical assistance. So they are key players along with the state agencies to reach the folks on the ground doing this work. We also have a strong connection with the University of Wisconsin-Madison Department of Family Medicine, who has done a lot of the evaluation and research for this work for WECOPI in the last few years. And WECOPI really aims to have a collaborative leadership model so that we can have collective impact in this setting and truly come together and bring all of these state agencies and non-governmental organizations together so that we're all working on the same goals and each have a unique role in what we can contribute to this sustainable movement. So here's kind of a basic overview timeline of what we've been doing for the last few years. WECOPI officially formed in 2008, and it really grew out of a subcommittee of the Wisconsin Partnership for Activity and Nutrition, which is basically our statewide obesity prevention coalition. The subcommittee on early childhood really blossomed into this WECOPI group because we had so much buy-in from some big key players around the state. In 2009, the governor also created the Early Childhood Advisory Council, which WECOPI became an official project team for in 2012. So now we have that great channel to infuse our content expertise for obesity prevention as well as recommendations right to the governor through that council. In 2010, the Wisconsin legislature approved YoungStar, which is our quality rating and improvement system, and that YoungStar serves as sort of an incentive providers to really tackle a lot of the criteria that we want for providers to be making these changes. And YoungStar does include some wellness criteria, which I'll touch on again in a minute, for both physical activity and nutrition. The rest of the timeline kind of goes over what I'm really going to talk about today, which was our Communities Putting Prevention to Work project called Active Early, which included a lot of provider trainings as well as the development of the Active Early Toolkit. So before I launch into our CPPW work, I just want to mention that WECOPI had done a lot of formative assessment work, which really served as the basis for the development of Active Early. Some of that assessment included an extensive literature review a few years ago, as well as a lot of key informant interviews with about 30 organizations that support providers, both here in Wisconsin and in Minnesota. We did focus groups with about 40 different providers, as well as interviews with Head Start and a lot of observations of child care centers and homes. This slide highlights some of the basic findings from that assessment, including a lot of the needs that were identified by early care and education professionals. So they reported needing better ideas for how to engage parents, how to provide low-cost, creative indoor and outdoor physical activities, ways for adults to lead activities and teachers at the centers, as well as ways for those teachers to role model healthy physical activity behaviors. The assessment also highlighted a lot of barriers that we see early care and education professionals running into when they're trying to offer physical activity, and this kind of goes off of what Dr. Pate was saying earlier. Here in Wisconsin we have weather where it's early April right now and it's 35 degrees out, so a lot of times we have trouble doing a lot of that outdoor activity. Kids might not have the appropriate clothing for outdoor activity, yet centers lack the amount of indoor space needed for some of these physical activities. These professionals also reported they just have a lack of equipment, or the cost of the equipment is a barrier. So we know that those are challenges that we're up against. So here's an overview of what our CPPW project Active Early was aiming to do. The objective of Active Early was to implement a physical activity intervention of 120 minutes during a child care day, and that included 60 minutes of teacher-led physical activity. The strategy we used was to provide a lot of training and technical assistance to providers that really focused on low and no cost physical activity strategies. This included some micro grants to providers so that they could make sustainable changes either at their center environment or so that they could purchase equipment to support physical activity. 20 child care programs were selected as pilot sites for this intervention, and throughout the 15-month project, 134 staff at those 20 sites were trained on our physical activity curriculum, and an additional 373 professionals were also trained that did not come from the intervention sites. So through this Active Early project, we developed a physical activity curriculum as well as a Train the Trainer course. And that curriculum included a self-assessment that was modeled after NAPSAC, which Massachusetts already mentioned. And that curriculum does link to the YoungStar point that I mentioned, so that everything ties together and providers are able to achieve more points through YoungStar if they're going through this training. So here's a snapshot of what the physical activity toolkit looks like. Active Early is on the left there, and this toolkit is designed to help early care and education professionals address childhood obesity by specifically improving physical activity and nutrition, both in their center environments as well as their programming. And you can see on the slide here we also have a companion document called Healthy Bites, which focuses more on nutrition, and the Department of Public Instruction led the development of that toolkit. These next two slides just show you screenshots of what's in the Active Early Toolkit for physical activity recommendations. I won't run through these all now, but I do want to point out that these recommendations were developed from a variety of model standards that already existed, including knapsack, recommendations from the AAP, the Robert Wood Johnson Foundation, and Caring for Our Children, which were all released very recently. So this slide just shows you some of the highlights of our evaluation. Each site that was a pilot intervention site for Active Early did a baseline knapsack assessment so that each program could develop their own unique quality improvement plan and make some changes that would be sustainable for their particular situation. We use the Environment and Policy Assessment and Observation tool to look at teacher-led physical activity as well as free play. And this slide shows that at baseline, centers were providing about 30 minutes of teacher-led physical activity, and that increased to about 80 minutes post-intervention. So the Active Early project really showed that implementing 120 minutes of physical activity is feasible in the child care setting. In addition to the observations, we also had accelerometer data from the children, which showed that as teacher-led activity increased, there was a significant decrease in the percent of time that children were spending in sedentary activities, as well as an increase in the percent of time spent in light activity. And although it was not significant, we also noted a trend of an increase in moderate to vigorous physical activity as well. And I'll just mention that our partner at UW-Madison, who was the evaluator for this project, is still working on this evaluation, and we hope to have a lot of these results published in the near future. This last slide gives you an overview of a lot of the accomplishments of WECOPI in the last few years. Since 2008, WECOPI has leveraged close to $2.7 million in public and private funds for both physical activity and nutrition in the early childhood setting. WECOPI was also recognized at the 2012 Weight of the Nation Conference, where there was a Let's Move Childcare Award luncheon that recognized the work of Active Early. I do want to mention that we will also be having a Let's Move Childcare Technical Assistance Workshop in a few weeks, so we're excited to continue that partnership with the Let's Move campaign. As you can see on this slide, I mentioned earlier the optional physical activity point that's included in Youngstar, which encourages providers to provide at least 60 minutes a day of physical activity. And at this point, about 1,400 early care providers have achieved that physical activity point. About 2,100 providers have also achieved the nutrition point in Youngstar, and that's out of a total of about 7,000 providers here in Wisconsin. I also wanted to mention that the Active Early project focused a lot on strengthening the licensing and regulation for child care providers, and that particularly did that through the licensing commentary, which we know is very important because it tends to be a focus for technical assistance to providers. They look to that commentary for a lot of details on what they should be doing, what are the evidence-based recommendations. So it's important to have strong language in that commentary for both physical activity and nutrition. And the work of Active Early is still continuing today through a project we're calling Active Early 2.0. One of our partner organizations has funding to continue that, which will expand on the pilots of Active Early and also bring it into the home. So a lot more parent engagement and recommendations for how to transfer that physical activity into the home setting as well. So I'll leave you with this contact information for both myself and John Morgan, who's our physical activity coordinator here at the department. And all of these toolkits are available on our website.
Thank you, Kelly. We will now move into the Q&A session. If you would like to ask a question, please type it in the chat box located on your screen. We've had a few questions come in so far, and the first one is for Dr. Pate. The question is, how do the guidelines include the needs of people with disabilities?
Well, the Midcourse Report does not specifically address special guidelines for young children with disabilities, but clearly the philosophy is that kids with disabilities should be included in the physical activity promotion efforts of child care centers to the greatest extent possible. I personally think that most of the specific strategies that have been endorsed in the report are applicable to children with disabilities, perhaps with a caveat that in some cases adaptations to either the physical environment or the instructional approach might be required. But certainly the philosophy is that young kids with disabilities should be as included in efforts to promote physical activity as other children.
Okay, great. Thank you. Do the other presenters want to address how they are addressing this population in Massachusetts and Wisconsin? All right. Well, we can move to another question. This is for Dr. Andrade and Ms. Nordstrom from Massachusetts. Can you tell us a little bit more about how you developed buy-in from center directors and staff?
Well, I think that had a lot to do with one-on-one relationship building. Using the mentor program, there was an opportunity for one-on-one training to really tailor the program to each daycare center. The Department of Early Education and Care and the Department of Public Health went to great pains to reach out to daycare center providers just to help them understand what the coming regulations. And it took about 2 years to implement after things were announced. They just wanted to take enough time to make sure that people had what they need, the resources, the information, the tools that they needed.
Okay, thank you. This question is for Ms. Stater from Wisconsin. Who are the key players in your statewide ECE group who have been organizing this work and are continuing to move it forward?
I would say our statewide group really has a truly collaborative leadership model. So we've got the 3 state agencies who really have the most impact on the early childhood setting, with the Health Department, the Department of Public Instruction, and the Department of Children and Families all on board. And then we have outside partners as well, the non-governmental organizations, some advocacy groups, a wide variety of different areas that can touch this setting, which I think is really important. And I think I mentioned that we've leveraged a lot of money in the last few years to do this, and I think it's important to point out that each of those funding sources or grants that might have come in have gone to different players depending on what the topic was. So it's not all just happening through the Department of Health, but it's shared with our partners, and we have this great group where we can all be at the table to strategically plan for the future so that we're all moving in the same direction. And then as funding opportunities or resources become available, each partner can step up at that time and take the lead on something else.
Thank you. Here's a question for the Massachusetts team. Who were the mentors and what were the qualifications to be one?
Okay, so the mentors were originally childcare health consultants in the state. Many of the centers have this position. They're independent contractors. They can be nurses. Many of them were nurses and were already consulting with childcare centers.
Thank you. The next question is for Dr. Pate. In your opinion, what is the one thing a child care provider could do to implement the findings of this report? And can you share a specific example of a provider or child care facility which has done this and how it has impacted physical activity for young children?
Yes, thank you. From our experience, the teachers assigned to the individual classrooms really are the key players, and I certainly believe strongly in in a policy approach that would engage the center directors, and I think that is an important first step in in making changes in a particular school. But from our experience, it's those individual teachers and teaching assistants in the classrooms that really make the difference. And so I was heartened by the comments from colleagues from Wisconsin and Massachusetts that heavy emphasis clearly has been placed on training of the child care center staffs, and I think that's critical. And I was also heartened by the vote at the one question that indicated a high priority attached to this training function. So I think it comes down to those teachers, and our group here at the university is just finishing a fairly large-scale intervention study in preschools, and from our experience, it really is the extent to which you can engage those individual teachers and have them take ownership of these approaches that's the salient element in effecting change. And we saw some wonderful things. Just one example from an elementary school here in our area in Columbia, South Carolina, but a teacher in Forest Heights Elementary School created a move-it time, and the individual kids, these were 4- and 5-year-olds, were designated as move-it helpers, and they got to pick the activity that they would lead the kids in the class each week. And to the earlier issue about inclement weather, the same teacher established an indoor analog to the outdoor recess period, so that even if the weather was inclement, she had planned activities in an indoor setting. So the basic point is, I think it comes down to these individual teachers and their commitment to this and the extent to which they take ownership of these approaches. And so I do think that effectively engaging with the preschool staff at that level is a critical piece here.
Thank you. This is a question for Ms. Stater. Would you describe what the 50 hours of on-site and off-site training is?
Sure. So that was through the CPPW project with Active Early, and that is training that was provided along with the Active Early toolkit that was developed, and as well as a physical activity curriculum that goes along with that. So it's about a 4 to 5 hour training for providers on how to use the toolkit and how they can make changes at their own site to support physical activity, whether that's environmental changes, programming changes, etc. I think technical assistance is also being provided through the Train the Trainer model. So technical consultants that work for the child care resource and referral agencies were trained so that they can go out and train additional providers within their own communities on how to use these strategies and how to implement environmental and policy changes at the local level.
Thank you. Here's a question for the Massachusetts team. How do the professional learning communities work?
Well, these communities are being established now through our early childhood services program. They're being established in different regions of the state. They'll be held at, I believe there will be 4 regions in the state, and there'll be a peer-led group. The mentors will be talking to mentors and working together, and we will be providing some experts in child development and child care services and so forth. But mostly it's an opportunity for the mentors to talk to each other, to share best practices, what works, what resources are the best, and that kind of thing. So they're going to be established during the next year, and they'll meet quarterly.
Okay, thank you. And here's a question for Ms. Stater. What are the next steps for your statewide ECE group in Wisconsin?
Well, we have a long list of things we'd like to accomplish. I think I mentioned that the Active Early 2.0 project is happening right now, so we hope to expand that to get a lot more of parent engagement and moving this into the home setting so that families are more engaged and it's not just in the child care setting. We're also doing a lot more with the nutrition and breastfeeding side. So the Active Early curriculum is ready to go, and we also have a Healthy Bites curriculum under development that should be available in the next year or so we can get that out to providers as well. And Wisconsin also has a toolkit called the 10 Steps to Breastfeeding Friendly Childcare, and so we're developing some training curriculum for that right now as well so that we can market these 3 toolkits as kind of a package to providers so that they're creating healthy environments that support all ages and both physical activity and nutrition.
Thank you. And here's one more question for the Massachusetts team. Recognizing the benefit of encouraging child care center directors to primarily focus on policy systems and environmental change, how do you demystify the concept of policy with center directors?
I believe the best approach that we've learned is to talk to them about, use the word policy in a different word, use a different word than policy, I'm sorry. Talk about them as a rule. What it might be kind of like a family rule that you might establish. Something that's familiar to them, something that they can apply to their own understanding. If it's just something that we always do, we pick up our toys after playtime at 2 o'clock. That's a practice, but it's also perhaps a policy. But it's just reducing it to the familiar, reducing it to terms that they're and activities and practices that they're familiar with.
Thank you. And thank you for all those questions. At this time we will end the Q&A. Thank you again for joining us today. As I mentioned earlier, you will be immediately directed to an evaluation at the conclusion of today's webinar. Please fill this out as it provides us with useful information for our future projects. It also has questions related to the work you are doing to improve physical activity in your state. I would like to thank the Office of Disease Prevention and Health Promotion for sponsoring this webinar, and I would also like to thank our speakers, Dr. Russell Pate, Dr. Craig Andrade, Christina Nordstrom, and Kelly Stater. This is the second webinar in our Physical Activity Guidelines for Americans webinar series, which will be hosted over the next couple of months. The presentations from today's webinar will be available on our website within the next few days. The web address is on your screen now. Please check our newsletters and website for more information regarding our upcoming webinars. If you would like to subscribe to ASTHO's Primary Care and Prevention Network newsletter, or if you have any follow-up questions, please contact Kristen Wan at kwan@astho.org, which is the email address shown on your screen. We hope that all of the listeners will use this webinar as a resource and will share the link with others once it is available. Thank you, and enjoy the rest of your day.